When you ask most people, what specialties have you thought about going into or would you like to work in? There is one specialty that often gets overlooked and is usually not on that list, and that is urology. Today, we're going to talk to a PA who has worked in this specialty for many years, from outpatient to inpatient. And he's going to tell us why you should probably consider urology. Going to give us the pros and cons about it and talk about what you actually do in the field. So if that sounds interesting to you, then please stay tuned. Hi, it's Michelle with the Medicine Couch. Thanks for joining me today. And as always, don't forget to hit that subscribe button down below.
My name is Innocent Rukundo. I am a physician assistant, and I have been in practice since 2007 in the specialty of urology.
Thanks for joining us today, Innocent.
Thanks for having me today.
Did you think that you were going to go into urology, or how did that come about?
Actually, no, I did not think of urology at all. I kind of landed in urology as a recommendation. So it was actually an internal medicine preceptor, and he had a colleague in urology who was looking for a PA. I applied and interviewed and ended up, getting into that world of urology, and I've been there since.
Right now, you're working in a large institution, but you have experience in the past of working both outpatient and inpatient. So as we go through this talk, you'll be able to share with us, I guess, both perspectives. So let's talk first about the inpatient. Now, in urology oncology, is it pretty much all kidney cancer? Like, is that where your group specializes in, or do you see other urologic cancers?
No, we see a wide variety of urologic cancers, from prostate cancer, bladder cancer, penile cancer, ureteral cancers, urethral. Pretty much a cancer can occur in all parts of the urinary system. Currently, my role is more specialized in that kidney cancer space.
When we're talking about the inpatient space, do you know if somebody is not working in oncology, just regular urology, do you know what that looks like for inpatient urology? Is there such a thing for PAs and NPs just to work regular inpatient hospital urology?
And inpatient is not just reserved to those who have oncology, of course, but because there's multiple urologic issues that can happen that can keep a patient in the hospital, from kidney stones to injuries to maybe complex urinary tract infections that lead to sepsis, and you have
Yeah.
to have somebody, admitted. So there's multiple reasons you can be in the hospital that are not cancer related.
So if somebody's working outpatient urology, what are they seeing mostly in outpatient?
Complaints coming from, urinary tract infections, to dysuria, burns when I urinate, to I'm having troubles urinating, slowing down of the urine stream, to erectile dysfunction, sexual transmitted diseases, to flank pain, which often, you start thinking of kidney stones, a variety of voiding dysfunctions. I'm urinating too often, I'm urinating too little. I'm waking up many times at night. To I can't seem to hold my urine at all. I'm leaking on myself, whether I sneeze or cough, or just simply because I can't make it to the bathroom fast enough. So those are the type of complaints that you'll see in the clinic area, including even things like I don't have energy, low testosterone, to also from female urologic conditions could be, burning when I urinate, but sometimes associated with urethritis, maybe secondary to menopause or hormone changes. And so it varies.
Let's talk a little bit about what the schedule is normally like when you're working inpatient. We'll start with that first. Like, how many patients are you typically seeing per day, and what is a typical schedule like for you? How many days a week and what kind of hours are you working?
And it's going to vary a lot based off of the type of setup you have within your team and where you're working. For example, if you're working in a smaller hospital, you may be the only team that's offering urologic services in that hospital. In that scenario, you may be on call a lot more. Therefore, you as a team are covering a large majority of, if not all, of the urologic related consults and emergencies that come in. If you work in a bigger institution, in which you have multiple providers offering urologic services, Your schedule may be different. It may be different in the sense that it may be a lot more set. Maybe you're working, 10-hour shifts, 8-hour shifts, 4 days a week or 5 days a week. And if you are an institution that even has some trainees and residents and fellows and so on, then you may not be taking call as an advanced practice provider. In that arena, your schedule probably, I would say, most of the times they expect to be maybe a 4 to 5 days a week, 8 hours to 10-hour shifts, mostly probably during the day, and not likely to be a nighttime shift unless you're on call.
And then when you're in the outpatient setting, is it pretty much a Monday through Friday, 8 hour shift like normal?
From an outpatient setting, it varies between, are you working for a large group or are you working for a small group in terms of private practice? In that scenario, your schedule may still be 5 days a week, 8 to 5 or 7 to 4, whatever you want to set up. However, you may have other tasks that you must also complete as part of that, including seeing consults that came in during the day in the hospital. If your group is covering the emergency room at your local hospital, then being part of the team that has to go see whatever came in through the emergency room during the course of the day, or at the end of the day, or you're operating and then you go see post-op patients.
Yeah, and you mentioned operating room, and I didn't think about ask that earlier when talking about the inpatient. So, do PAs and NPs often first assist in urology surgeries?
Physician assistants, yes, they do often first assist in urology surgeries, and more so in the last, I would say, probably maybe 10 years or so, a lot more involved in the robotic surgery. I mean, because in the specialty of urology, the robot is used a lot
Oh, okay.
in assisting with prostatectomies and now in nephrectomies, and also utilized in cystectomies. So the role that PAs or nurse practitioners who are surgical first assists play in the operating room is pretty important and pretty crucial. And you build this great rapport, you have this training that you go through, and you and your surgeon are working hand in hand to really take care of that patient that's on the operating room table.
Does it tend to be more PA heavy or NP heavy?
It tends to be more PA heavy. And I think a lot of that has to do with the surgery or operating room expectation. I think that's where it most often will favor and lean more towards PAs. However, I do see that there's definitely, a significant role in partnership with our nurse practitioners in a lot of the areas in the world of urology.
So another big question that people often have about a specialty is how many patients, do you have to see in a day? There's some specialties like, dermatology when people are seeing routinely like 45 to 60 patients, a shift. What has been your experiences in urology? Let's talk about outpatient.
Oh yeah, and the dermatology scale is not far off from the urology volume in the clinic. It varies, from my experience, it varied anywhere from 35 to as high as 65 patients in a day.
What?
A lot of that, though, varies depending on what the patient complaints are or what type of clinic you may have set up that day. If it's tends to lean more towards the prostate disorders, and you're likely to see a larger volume of patients in a day. Versus if it leans to more of a general urology, you're likely to see a lesser volume. However, it's still pretty high because you still expected to see close to 35 and 40, 50, 60 patients in a shift. Yeah.
How is urology able to see that many? Are a lot of the cases pretty straightforward? Are you seeing a lot of just follow-ups?
Well, urology as a system is sort of small. It's small because you start from the kidney all the way to the urinary outlet, and so it's just that small part of the human body. But a lot of things can happen in that small part of the human body. So a lot of what you're seeing in clinic can be many, many follow-ups, meaning we started this particular therapy or this particular treatment for this condition, urinary condition. You come back a month later, how are we doing? Do we need to make some changes? So you have follow-ups similar to that, including post-operative follow-ups, just to check on the incisions, to remove Foley catheters, And then you have, of course, your new patients, which those patients are going to require a longer appointment, dedicated time to really thoroughly go through what's going on. So I would say in clinic, it's probably a lot more heavy follow-ups, and that's why the volumes tend to be so high.
In inpatient oncology, roughly how many patients a day are you taking care of?
In the inpatient world, I would say probably I think most APPs working in a urology probably average maybe 7 to 12 probably patients daily.
And that would involve, rounding on them in the morning, seeing where they're at, taking care of any problems that come up throughout the day, putting in orders, new tests, those kind of things.
So the expectation during the day as an inpatient provider in the world of urology is usually rounding on the census of patients that you typically have. If you have responsibilities of doing consults, then those come in randomly. And that can vary depending on what agreement or expectation you have with your supervisor. In my experience, it's been anywhere from just taking the first call and discussing with the emergency room physician and whoever is calling you for a consult, and you either start a plan, and if a provider needs to come in, and then it could be the attending that comes in and sees the patient and provides whatever necessary care is needed. Or on occasion, you could be the one that's covering the ER call, for 24 hours. And in that scenario, you may have to wake up and come in at 2:30 in the morning for anything from gross hematuria to urinary retention, difficulty catheter placements to evaluate a priapism and help reduce that. So those can be the responsibilities and tasks of a urology APP in a hospital setting.
In the specialty of urology, are there actual hands-on procedures that PAs and NPs can do, whether we're talking outpatient or inpatient?
PAs in the world of urology can do prostate biopsies, cystoscopies, procedures that are involving urodynamic studies. They can do procedures from, reducing priapism to complex catheter placements, to placing suprapubic catheters for urinary drainage, to placing testosterone injections or pellets, to pretibial nerve stimulation. There are a varying, procedures that are within the specialty that PAs or nurse practitioners can do, not only in clinic or in a procedural space, sometimes in the operating room.
What are some of the things that you have been surprised about in this specialty?
The biggest thing was how much happens within the small system. You talk about kidney stones, there's numerous sizes, numerous compositions of kidney stones. So many things can happen from a kidney stone obstruction. And then you lead into, the ureter itself, that small channel, that small tube can have so many things that can happen to it, and and the consequences that occur as of a ureteral stricture. And then you keep going down into the bladder. The bladder has so many different ways of functioning, and that can lead to that patients will have problems from urinary frequency, urinary retention, incomplete bladder emptying. And then you may have some neurogenic components to it that lead to the urinary issues that you may be having. And then now you lead to, if you're a man, you've got a prostate. Then you have to deal with the size of the prostate, its obstruction, and then if it has a tumor in it, if it's got an abscess. So there's so many things within that small system that can happen and cause these different conditions. That was a big surprise.
Yeah, so what are the things that you have that you think that people would really love about this specialty? Anything that you think is a draw that would bring them to this specialty?
Biggest draw is number one, yes, it's a small system. A lot can happen to it, but there is very rare, true emergencies associated with it. And as an APP, there's a lot you can do within that specialty. It offers opportunities for autonomy, and then once you do something to take care of a patient, there is some level of instant gratification because you address something and it's like, whoa, that helped, and you can see immediately the benefits from your intervention.
Because we are dealing with a sensitive area of the body that a lot of people aren't comfortable with. Does that lend any particular difficulties to your work on a day-to-day basis?
It lends to you as a provider having to have a different level of professionalism. Not really different level, but being more aware of remaining professional in having some very what many may consider uncomfortable conversations where the genital area is not something that everybody's eager and open or even often comfortable to come see you for, and sometimes that could be something that they've struggled with for some time, just building that courage so that they could be able to come in and be seen for that particular complaint.
A big question that people often ask about on a job and are looking at a specialty is compensation. Where do you feel, just in general, urology falls on the scale? Is it, an ultra high paying specialty? Is it really low specialty? Or does it just kind of seem to be in the middle?
I think urology falls within the middle, maybe pushing the higher side of salary ranges. It compares really to other surgical subspecialty salaries.
What kind of advice would you give them as far as how to start preparing or making themselves a good candidate to work in the specialty?
I think urology is a lot more of a surgical specialty. So if you're considering working in urology and if you're interested in working in urology, whether you're a student or you're somebody already in a career, is thinking more along the lines of preparing yourself in the surgical arena. Having experience in the operating room, having experience of caring for post-operative patients or preparing patients for surgery is very valuable. And I think that's the areas in which you may want to sharpen your skills or review again, because a lot of what you will interact with, whether it's in the general urology arena or if it's in a hospital space or oncology space, is going to be surrounding a lot of surgical or post-operative patients.
So that was interesting what you said. Like, when I think of like outpatient urology, I don't surgery doesn't come to mind. So in outpatient urology, the physicians, are they mostly working just outpatient, or are most of them splitting their time between surgery and their outpatient practice?
Yeah, most of them are splitting their time
Oh,
between clinic and the operating room and what some may consider more, procedural days.
so how about like resources? Are there any good like national societies or anything that you would point people to be able to find more information about the specialty?
Absolutely. So the American Urologic Association is very good. It is very big and it has a lot of information. And in the recent years, they have a very robust and strong advanced practice provider section of the American Urologic Association, and they have very good conferences yearly with this carved out time for the APPs to review a really more of a general urology setting. There is a Society of Urologic Oncology, which is kind of a subsection also within the American Urologic Association, and they have a lot of very good resources as well. As far as PAs, there is a Society of Urologic PAs, and that is another area to kind of dive into and get in and just interact with other PAs.
If we're talking about the students now, or people that haven't gone to PA school yet, or that haven't had their rotations lined up, other than having a urology specific rotation, are there any other rotations that you feel are the most helpful or the most connected with urology?
My general surgery rotation helped me out a lot. Being comfortable in the operating room and being comfortable with the instruments and so on. The other specialty I think that helped me the most personally was the emergency medicine rotation. Why? I think just focusing on the acute problem was very good. It's very beneficial in the urology specialty as well because you just try to focus on the complaint at hand.
Now that you have the benefit of being able to look back and seeing throughout your career, do you still think it's a good move to move into urology straight as a new grad, or do you think people should go work in family practice or some other area and get a foundation of medicine before going into urology?
No, I think going into urology as a new grad is absolutely good. And in the hopes that you are also working with a good team, with a good supervising physicians and attendings that are going to dedicate the time to develop you and train you well in the specialty.
Any final pitch about why you think people should really consider this as a specialty?
In the urology arena, in the general urology space, there's a little bit of everything from the different parts of the system that it does help you from getting stagnant in a way. You're not taking care of the same things all the time. Yeah, you may have five prostate related patients from BPH to, maybe some cancer, and then boom, sprinkle in testicular pain. You see what I mean? So
Yeah.
you get these little variations, and then oh, I got a kidney stone, or now I have urinary tract infections. So there's a lot of different complaints that you could be dealing with all in the same workday. There's many avenues of working in the world of urology, from general urology, like we talked about, and sometimes these things can be very split into where you're mostly clinic or you're mostly on the inpatient side or you're in the operating room. So there's variety. There's variety, and you can be in all three of those arenas all at the same time, which is a great thing, I think, for a practicing APPs at having the ability to go through all these different spaces.
Thank you so much for giving us all this great information in this, and I really appreciate your time today.
Thanks for having me again. This was great. It's good to talk about urology.
Now, urology is not going to be for everybody. There is definitely a lot of talk about urine and urination and sexual dysfunction. And so, if that's not something you're comfortable with, then this is not the specialty for you. But it does sound like a specialty that's got a lot of great variety, but also gives you the ability to master the anatomy and physiology of a smaller system. So, it definitely has its positives. If you're interested in a video on how you transition into different specialties, you can watch that video here. I also have videos on working in other different specialties or cool and unusual jobs. So be sure to check out the playlists on my main channel page. Thanks for joining me today. Take care, stay sane, and I'll see you next time on the Medicine Couch. Bye.